Okay. Good afternoon, and welcome to all of you joining us today for this important discussion, housing and human rights. I am Ken Clark, Director of the Tompkins County Office of Human Rights, the sponsor of this program. The United Nations Office of the High Commissioner of Human Rights identifies housing as a human right. Quote, under international law, to be adequately housed means having secure tenure, not having to worry about being evicted or having your home or lands taken away, end quote. Housing at the local level, however, is rarely understood as a human right. Governmental policy, programs, and national housing strategies are required to establish housing as a domestic human right. Many of us are well aware of the growing challenges of homelessness in our own Tompkins County community, the struggles to find affordable housing, the shortage of temporary housing since the closing of St. John's Community Services, the increasing problem of adolescent homelessness, the mental health and public health impacts and implications of homelessness. Many of us know the what is realities of homelessness. On the other hand, how might we imagine and work toward what ought to be? That fair housing should be and can be a domestic human right. Can we envision what Ithaca, New York State, or the United States would look like if a right to a dwelling was a protected human rights category? How can what should be reimagine what is? There have been local efforts to bridge the gap between what is and what should be. Tompkins County officials recently announced plans to acquire property on Cherry Street in Ithaca to build a long-term emergency shelter. County collaborations with contracted motel partners will increase the number of beds for houseless persons thanks to the Temporary Housing Assistance Program. A Code Blue shelter at the former location of Key Bank opened in November, which can accommodate up to 50 or more persons. The Human Rights Commission, the advisory organization to my office and the Tompkins County Legislature, has been documenting the stories of homeless individuals, gathering data that will be shared in public-facing events at a later date. Today, we have with us 5 very capable community leaders whose work contributes to bridging the gap between what is and what should be. They will offer human services, legal and public health perspectives and practices that affirm the right to housing. Our panelists are, and they will speak in this order, Liddy Bargar, Director of Housing Initiatives, Human Services Coalition of Tompkins County, Danielle Harrington, Executive Director, Tompkins Community Action, Rick Alvord, Coordinator of Community Youth Services, Tompkins County Youth Services Department, Dan Pesciotta, Attorney with LawNY, and Dr. William Klepack, Medical Director, Tompkins County Health. After our presenters speak, we will have a period for questions and answers. Liddy, will you get us started?
Hi, sure. Good afternoon. Thank you, Dr. Clark, for the introduction, and thank you if there are people here. That is cool. I am going to share my screen and just give a little bit of information about the continuum of care and what some of the work that we're doing and some of the foundation behind the work that we do. And I'm going to go fast because there's many of us and I want to hear from everyone. All right. Whoops. So my name is Liddy Bargar. I use she, her pronouns. I'm the Director of Housing Initiatives here at Human Services Coalition. Human Services Coalition is what is considered the lead agency of the continuum of care for Tompkins County. Continuums of care. Every community in the United States is covered by a continuum of care, and they all look a little bit different. Ours happens to be a single county continuum of care, so all of the work that we're doing is sort of laser focused on the city of Ithaca and Tompkins County and the homeless response system in that within those borders. It's a HUD initiative, and the mission of the continuum of care is up on my screen here. But we work as a large cross-sector planning body with the mission of we envision a community in which homelessness is rare, brief, and one time. And to do that, we have a few strategies. One of those is through a lot of planning and convening of those stakeholder meetings. We also act as a funder for the community and bring in about $1.2 million of certain kind of HUD funding into our community every year. I'm going to talk a little bit about the kind of projects that funding supports later on today. And then we also have a goal of promoting access to services and housing. And obviously that fits in really well with the idea that what a wonderful world it would be like if housing was a human right. So when we talk about ending homelessness, we use this language of rare, brief, one time, and equitable. These slides will be available, so I'm not going to get too far into these, but basically know that there are metrics for each of those words. So what does it mean for homelessness to be rare? It basically means that there are enough units, services, vouchers, beds, whatever it looks like, so that it doesn't mean that there is never a homeless person again, but it means that there's enough services to meet the need of people enough of the time that it truly is a rare experience for a person to become homeless. When we say brief, we're talking about the goal is that if a person does become homeless, they're stably rehoused within 40 days. That's a HUD metric that comes to us from HUD, but sounds great. I'm going to tell you how close we are to that later. One time, that seems logical, but basically the hope is in the rare circumstance in which a person becomes homeless after their brief stay in the homeless response system, they don't return to the homeless response system after being permanently housed. That's what we're working towards. You will hear me use the word, and probably other people when we're talking about people experiencing homelessness today, homelessness. And that's a word that I think it's just worth knowing how it's being defined, at least when the continuum of care is saying it, right? So there's a very specific definition about what is a person experiencing homelessness. And these are the true like HUD definitions of those words, but basically it covers people in a variety of situations, but mostly people who are sleeping in a place not meant for human habitation, people who are sleeping in a publicly funded emergency shelter. Young people have a sort of a broader definition where they can be in more of a couch surfing situation. And then there's this category 4 definition, which covers people who have a unsafe situation as a result of their home and need to be rehoused, basically. It used to cover only domestic violence, sexual assaults, stalking, and has been expanded to have this broader definition of what is domestic violence. But with data, if you're seeing it from me or hearing it from HUD, we're talking about people who are experiencing one of these definitions of homelessness. So one of the things you heard me say earlier is that one of the activities of the continuum of care is to connect people to housing and services. And we do that primarily through a process called coordinated entry, which we could talk all day about. Look me up, we'll explain it to you. But basically, it's a large scale system through which people are prioritized based on a set of vulnerabilities for a certain set of housing that is basically held aside for folks who meet the eligibility criteria. This on the screen is our current stock of housing that has those specific set aside units for people experiencing homelessness, and that coordinated entry is able to directly refer people experiencing homelessness into. You'll see that permanent supportive housing category is probably where our like largest stock is, but don't get like too excited because I think that's basically what amounts to 170 units total. So these are the projects, but we are not to scale in any of these areas, right? So rapid rehab. I'm going to talk a little bit about what permanent supportive housing is because that's the closest thing to right to housing that exists in our system. And then those are some of the other housing programs available. So permanent supportive housing is important because it addresses this sort of situation that we encounter in the homeless response system where, and I think maybe there's other people who are going to speak a little bit to this later, where there's this treatment first model that's sort of outdated and in the 70s and 80s was popular for the like sort of most common intervention to rehouse somebody involved this like long set of steps where like first they went to a mental health or substance use treatment program and then there was a stay in a halfway house and then they sort of had to earn these they call it the staircase method, and then at the very end you get your set of keys for permanent housing. And what more than 20 years of research has sort of led us to know is that until people can meet that base level, Maslow's hierarchy of basic physiological needs, breathing, sleep, water, shelter, clothing, it's sort of almost impossible for them to do that self-actualization piece, which is the piece that we are hoping people will do by having them go through that whole treatment continuum, right? So self-actualization is when people are coming into their own, they're going to thrive, they're reaching personal internal goals, they're an integral member of community, that's the top of the pyramid. And that treatment first model was kind of asking people to get to that stage before they even had the basic support to support them in that. So where all of this research led is to this model of permanent supportive housing. And so what is permanent supportive housing? It's a housing intervention that combines a permanent, as you might notice from its name, actual physical location where people can live, that has lower thresholds for entry and then a higher level of access to services that are voluntary once people have entered into the housing. I think a few things that are important to like think about with permanent supportive housing is that this isn't a clinical intervention, right? So this is a housing intervention. And we recognize that in our community, there might be like a little bit of a expectation that a housing intervention is going to also serve as that clinical, like highest level of need care that we think about for our most severely mentally ill and other people in our community. Permanent supportive housing is the highest level of housing support that exists in the continuum of care, and then you're going to be reaching into those clinical levels of care. But what does it offer? It offers a lease. It offers a permanently affordable location for people. So people who are living in a permanent supportive housing site are never going to be paying more than 30% of their income for the cost of that housing, although they are encouraged to work and grow their income while they're in that housing. They are offered access to services, but those services are not mandatory. It's designed to serve people who have that highest level of needs, people with poor credit, a limited mailing address, and who are not meeting sobriety requirements for other programs. Looks a lot of ways. It can be site-based or scattered site. People have those leases and they do have tenant rights, which does help grow people's independent living skills as well. These are some of our outcomes. These are actually from 2023. Look forward to a new slide next year. Just as sort of like a snapshot of how we're doing towards that rare, brief, and one-time goal that we have for our continuum of care. We can do better. People are staying a long time in our emergency system. That speaks to the scarcity in our model. BIPOC folks are overrepresented in our system. We do have about 30% of people returning after a permanent destination back into our homeless response system. And people are not exiting into those permanent destinations the way that we would hope to see in like a fully scaled up system. And this is just our membership agencies from the last year. If people are interested in finding out what it means to be a COC member, please let me know and I can tell you more. Thank you. I believe that that is all.
Okay. Thank you so much, Liddy. And you will be followed now by Danielle.
Hi, everybody. Danielle Harrington, Executive Director at Tompkins Community Action. We are a large nonprofit organization, anti-poverty, mission-driven organization who supports the community through food assistance, housing assistance, and early childhood programs. You saw us on the list, Liddy shared with the permanent supportive housing options. I want to just speak briefly about what housing programs we have, but it all comes back to those basic needs on that first level of that hierarchy pyramid, food, shelter. Without that base, it's really hard to do everything else. And everybody knows these days and times are hard for everyone. Crisis is everywhere. Financial stability is tenuous for many. And for those living in poverty, histories of trauma, histories of mental health and substance use, things are even harder these days. What we do at Tompkins Community Action is we try to address some of the affordability issues with our rental assistance program, the Housing Choice Voucher Program. Section 8 is what it was called. It provides rental subsidies for units that have had a housing quality standards inspection, so it meets minimum safety requirements. It's an income-driven program. The program helps pay some of the rent, and households get to move in and stabilize. There are other programs attached to that. The Family Self-Sufficiency Program encourages households to increase their income so that they can move off the program and not need the rental assistance ongoing. There's a home ownership option, which allows families and households with steady employment who are eligible to get a mortgage from a financial institution to purchase homes and transition that rental assistance into mortgage assistance. And that is where we have seen the most dramatic stabilization and working off of the program. You can have up to 15 years of assistance in that, and we have been seeing from about 3 to 5 households no longer need the subsidy. And then lastly, the program that we've added in 2024 is called Making Moves, and it's a partnership that we have with the Ithaca Housing Authority's voucher program, where staff help families with children under 17 who live in high concentrations of poverty in Tompkins County move into other areas with their voucher assistance, to areas with better schools or employment opportunities or resources available to help meet the needs of that family in a better way. We also do the supportive housing programs. Liddy mentioned permanent supportive housing. We have 132 units of various groupings. It's important to remember that the lease provides the housing stability. Our staff partner with the resident to make sure that rent portions are paid by doing budgeting or helping stabilize so that residents can choose what goals they'd like to work on, employment, education, volunteering, and that can come after a period of stabilization where basic health needs are met, food becomes an item that's secure, you know where your next meal is coming from, you're coming in from outside or the shelter system, and you don't have to carry all of your belongings with you, and you don't have to, figure out your whole day is not focused on your survival, which allows time to connect with community resources to help move forward that stabilization to get to the point of education and employment. Liddy mentioned it's a housing program. It's not a clinical program, so the staff that we have working with the residents help create connections and facilitate those connections to make sure there's insurance and make sure the residents get to their appointments, and also build on the housing stability skills, because with a lease, you have a landlord and you have to maintain that lease to prevent eviction. So we work on those kinds of things. In general, housing affordability and housing availability are the biggest barriers which contribute to some of the rising numbers of our unhoused folks in the community. There's a misconception that a lot of people are coming to Tompkins County because we are rich in services. And I think that we have a lot of data that demonstrates that these are community members who have fallen through cracks and are part of our community. I think that the continuum has more to add. Liddy said we were just starting with our permanent supportive housing. We have prevention, diversion, strengthening the shelter system that Dr. Clark mentioned in the beginning. And the continuum is always changing. I've been here for 20 years and I've seen different formats of HUD wants this focus or HUD wants this focus. That didn't work. Let's go back 10 years. It's constantly morphing. And then the systems within the community play quite a role. And I think we'll see more of that to come. Thanks so much.
Okay, Danielle, thank you. Rick, we'll hear from you now.
Thank you, Dr. Clark. I just want to say it's a real honor to be a part of this panel and get to work alongside people like Liddy and Danielle, who are doing so much in our community to move this issue forward. I think framing housing as a human right recognizes the universal truth. Housing is a fundamental human need. Stable housing provides safety and security for individuals, and it contributes to the health and well-being of the community. Yet, in Tompkins County and across the nation, we face a severe lack of available and affordable housing. This crisis disproportionately affects the most vulnerable members of our community and undermines the well-being of people. The affordability crisis really has reached an alarming level. Middle and working class families are being squeezed as rent prices and inflation far outpace wages. Many households are forced to allocate 50% or more of their income toward housing, leaves little room for other essential needs. People are pushed to seek housing farther from their jobs, increasing transportation costs. All these pressures are felt most acutely by the marginalized populations, including low-income families, individuals with disabilities, and youth. My experience is working with youth and young adults who are trying to establish the safety and security that affordable, stable housing can provide. These youth and young adults include youth who have aged out of foster care and with a system that doesn't provide adequate support. They're LGBTQ youth who have been rejected by their families and face discrimination. They're often youth escaping abusive situations and many times living in families who are also struggling to maintain stable housing themselves. For these populations, housing insecurity aggravates existing challenges, making it harder to access education, employment, and healthcare. Danielle spoke to that a little bit. Declaring housing as a human right acknowledges this essential role in human well-being. Human rights framework enables us to prioritize the development of adequate, affordable housing. while also implementing protections that help people remain housed. By doing so, we can, in doing so, I think we really need to invest in building more affordable housing units to meet the growing demand. We need to advocate for policies that strengthen tenant protections, so they're able to avoid evictions, and discrimination in housing. And we also need to expand incentives to ensure housing is accessible at all income levels. Viewing housing as essential to a healthy community emphasizes its connection to other fundamental rights, such as health care. Understanding these connections can bring us together. And I think we really do need to come together to support initiatives that expand affordable housing options. We need to partner with and strengthen organizations such as the Human Service Coalition and TC Action, who are addressing housing insecurities. And we also need to advocate at the state and federal level so that housing can be recognized as a fundamental human right. Taking these steps will move us closer to a community where everyone has a healthy foundation that they need to succeed. I would be amiss if I didn't promote a couple programs that I feel are essential to people that are struggling, and that our office helps support. One of those is an Open Doors program from Family and Children's that maintains a 24/7 warm line that will respond at any time of the night to a youth who may need services. They can be reached at 607-301-3002. And another very vulnerable population that I'd like to highlight are youth and adults that are often being trafficked. We call that CSEC, commercially sexually exploited children. If you know anyone who may be facing that, you can call the Advocacy Center, 607-277-5000, or the Learning Web, 607-275-0122. Thank you.
Thank you, Rick. Thank you very much. Okay. Dan Pesciotta, welcome your comment.
Thank you. I'm Dan Pesciotta, he, him. I am a staff attorney with Legal Assistance of Western New York, otherwise known as LawNY. We're a not-for-profit law firm who represents low-income individuals for no fee. I'm in our housing group, which is obviously relevant to our discussion here today. Most of our clients are usually coming to us in one form of crisis or another. Usually they're facing an eviction or an imminent eviction, whether that's because they've fallen behind on rent or their landlord has decided not to renew their lease for one reason or another. So we represent those clients and do everything we can to help them keep a roof over their heads, or at least buy them as much time as we can so they can look for other housing while their landlord is trying to put them through the eviction process. As many of you likely know, there's lots of very specific requirements in New York that landlords have to follow in order to evict a tenant, and we are we work hard every day to make sure that landlords are following those very specific requirements. There are requirements about notice and habitability and things that the landlords have to allege in their petitions with the court. So we make sure that we're protecting clients' rights for all of those all of those existing protections that are already in the law. A couple of specific things we do some fair housing work in situations where clients have been denied housing in one manner or another based on a protected class, so housing discrimination. I also refer a lot of work to the Central New York Fair Housing, and we do some work with the Cornell Tenants Advocacy Practicum as well. There's also the New York income discrimination law that was passed relatively recently that's it's supposed to prevent landlords from discriminating against tenants based on the source of their income. In particular, I think that's aimed at tenants who have, for example, Section 8 vouchers to prevent tenants from, being denied housing just because Section 8 is helping them pay for their rent. We did unfortunately have a bad ruling here in Tompkins County recently where a Supreme Court justice held that law is unconstitutional. That's currently on appeal. That's something we're keeping a very close eye on, and hopefully we will see that overturned. So our clients who are receiving Section 8 and other housing subsidies, aren't unfairly discriminated against just because they're receiving assistance on their rent. One other recent development that we've been working on quite a bit recently is at the very end of last year, the New York legislature passed a provision that now permits tenants to take affirmative action against landlords who are not meeting their habitability duties. So, basic things like making sure the apartment has heat and hot water in the winter. If there's a bug problem, that they're hiring an exterminator and quickly addressing that, and various other things that can make an apartment uninhabitable or unsafe for a tenant. Previously, really the only way for a tenant to enforce that right was either to raise it as a defense once a landlord tried to evict them, or they would have to go through the longer process of bringing a claim in Supreme Court or small claims to attack the landlord. But now they can bring a summary proceeding in an accelerated manner, the same way landlords can bring an accelerated proceeding for an eviction. So that's another thing we've been working on over the past year to try to help some tenants affirmatively enforce their rights when that comes up. A couple of tangentially related services we also provide. We help clients who've been denied Social Security or Social Security disability benefits, which doesn't directly impact housing, but often there's a lot of crossover between our clients who are having housing issues and who are on Social Security benefits. We also do a lot of reentry work, helping clients who have past criminal records kind of get back into society, and if they're being discriminated against based on their criminal record in housing or otherwise, we can help them out with that. And just to make sure we're respectful of time here and have time for some questions, I think that's all I have to say for now. So thank you.
Great, thank you, Dan. Last and certainly not least, Dr. Bill Klepack.
I've had the benefit of hearing what everybody else has said. I'm speaking on behalf of Whole Health, Tompkins County's department, which encompasses both public health and mental health. And I'm medical director for public health. We do have a medical director for mental health as well. And I'm going to take a little liberty to talk about mental health issues as well as public health issues. Before I start, I think few of us can really imagine what it's like to be inadequately housed or homeless, what it's like to have that lack of security, what it's like to be at risk bodily as well as mentally. But I want you to go there for a moment as I talk about first some of the public health issues that we're concerned about and the mental health issues. The mission of Whole Health is to identify gaps for care for persons in our community and to work with partners to try to reduce those gaps as much as is feasible to do. Homelessness often is a result of gaps that we have in our community that lead people to falling into being inadequately housed or homeless. It's far less common for it to be solely the result of an individual, solely the result. It happens. People who, for example, have schizophrenia, they have a disorder that is extremely challenging and can lead them to reject care that we do have available. And there are other sorts of situations where that can be true as well. But let's turn to some of the issues that when you're inadequately housed or homeless arise. And a lot of it has to do with uh, instability. You don't have an address, perhaps, at which you can receive information that you need to have and that you need to respond to with regard to health. You may not have phone coverage. You may not have batteries to run your cell phone if you do have a cell phone, or a way to charge it up appropriately, and that causes communication difficulty. When you get into these kinds of issues of lack of communication, you get into issues about access. And without access to care, things happen in a bad way. You also probably have some sanitation challenges. You probably have some crowding, particularly if you're living in situations of various types out on the street or sometimes in shelters and so on, and a lack of your personal security to being accosted, perhaps raped, um, robbed, etc. So we in public health are concerned about the injuries, the physical injuries that people encounter, the timeliness of addressing those injuries. If you're on the street and you don't have systems available to you, those injuries go for longer periods of time without being addressed. Wounds that might have occurred instead of being promptly taken care of can become abscessed. Those abscesses become a greater and greater problem as time goes by, and often will require much higher level of treatment than if they were taken care of early. I mentioned rape. Rape is a tragic thing to happen to anybody. Obviously leads to great fear for the future, but also to infectious diseases. And people who are on the street or inadequately housed, we're concerned about the sexually transmitted diseases that they acquire and the risk of them transferring them to other persons. We're concerned about foodborne illnesses, bacterial illnesses, viral illnesses. Some of these are communicable to other people, and they can become a focus of spread into the larger community. People acquire pneumonias when they're cold, when they're inadequately nourished, when they're out of secure housing. And then they have chronic diseases. A lot of these folks have asthma, diabetes, chronic obstructive lung disease, high blood pressure. It's difficult to stay on your medications. It's difficult to access appointments for healthcare, to monitor and help continue these things, as well as dental care. And routine dental problems become abscesses, become teeth that need to be pulled out. It becomes tragic. And preventive care. Oh, we all need, and a lot of folks who are out inadequately housed are getting into the age group where they need preventive screenings for a lot of things: colon cancer, breast cancer, blood pressure screenings, etc. We do have groups that are working to try to help this. Reach Medical is one in our community that is trying very hard, but it's a big challenge. And if we can't manage these chronic cares and these preventive cares, this other side of this coin, besides the human need to take care of each other, to see to each other's needs, the other side of the coin is the economic side. All care that is not delivered in a timely fashion downstream, as that illness, as that condition develops, becomes far more expensive to care for. And landing into an emergency room, or having to be hospitalized, or having to have a surgery when a simple antibiotic would have prevented the whole thing, means that there are a lot of healthcare dollars being spent. And those healthcare dollars ripple over to all of us, because all of those are reflected in bad debt for the medical system, which is paid for by taxpayers, and insurance costs, which all of us pay through our premiums. So both sides of the coin, human and economic, play out to be things that we should be concerned about. I think we can't ignore post-traumatic stress syndrome. And people who are inadequately housed, who under daily stress, lack of security, develop post-traumatic stress syndrome. In the military, I'm given to understand that we've learned how to treat that and that we're doing much better in the veteran population than we used to. But I'm also given to understand that we haven't yet transferred that knowledge into this sphere of the inadequately housed and the homeless. And that plays out in some of what I think we'll talk about in terms of the challenges when we put people into supportive housing, how they're able to use it. I triggered on Liddy's mention of the goal is one time, brief, and with good support. Because I'm given to understand that the more times that people come back into homelessness or inadequate housing, the longer that they're in that situation, the worse the outcomes can be. The worse the post-traumatic stress syndrome can be, the more difficulty with remembering how to live in a home can be. That's hard to believe, isn't it? That you could forget how to live in a home and manage your affairs. But I'm given to understand that that's an issue. So I could go on a bit longer, but I think we could touch on maybe questions and answers about the substance use issues. We could talk a little bit about how it is that people fall into these situations of being inadequately housed. And I think we could talk about the societal dynamics over the last 40 years that have caused homelessness and inadequate housing to have blossomed into what it is today, something that we're struggling with all across the country. But perhaps those questions will come.
Thank you, Dr. Klepack. And thank all of you for your wonderful and insightful commentary. We're going to now turn to the questions and answers, and we have one question that's come to us from Simone Gatson. Her question is, or comment and question is, I saw Liddy's slide about system-wide outcomes, but how successful is permanent supportive housing as an intervention?
Yes. So as I was making my presentation, it occurred to me that I put those outcomes there, and that was for our whole system, like people experiencing homelessness, everyone in the whole system. And they're kind of like bleak and depressing. And I forgot to mention that permanent supportive housing has really great outcomes. So our success by that measure of very brief one time for people who are in permanent supportive housing is that about 90% of people who are in our permanent supportive housing projects remain housed or move to a second stable, positive housing destination. So our success rate for PSH or permanent supportive housing is about 90% consistently year over year after year for those projects that were named in my presentation.
Okay, thank you. Dr. Klepack, you talked about the societal dynamics that would require some further elaboration that have contributed to homelessness, especially over the last 4 or more decades. I mean, I certainly personally can attest to that, having been working with refugees and then as an assistant pastor in San Francisco in the 80s and seeing, a tremendous homeless problem, which was largely centered in the Civic Center area behind City Hall, in the financial district, in the Tenderloin district as well. But could you talk a little bit more about those societal impacts that led now to what has become an increasing and exponential problem of homelessness?
I'd be glad to. I'll stretch my expertise a little bit in doing so, but I'm certainly open to all of you commenting upon these dynamics as I understand them. I think number one is that over these last 4 decades, we've seen progressive income disparity between the richest of the rich and the poorest of the poor. That erosion of the middle class is a factor. In the early 80s, the unemployment rate went significantly up. It was one of the highest unemployment rates since the Great Recession. Back in the day, back in the 80s and going into the 90s, the residential mental health facilities that we had in New York State began to release residents of those facilities into the community, sometimes with not the greatest of supports to help them cope in their new situation. We've continued to have through the decades these economic stressors coupled with recessions. We all know about several of them intimately. Housing that used to be affordable, especially in the large urban centers. I'm given to understand such things that you might have called flop houses, for example. You could afford to live there on a disability income, for example, and make ends meet because it was so inexpensive, even though they might not have been the greatest places to live. But those gradually have disappeared with, and especially in urban centers, gentrification, being torn down to build more lucrative apartments. The exploding home prices that we've all seen have certainly been the issue, and the rising rental fees. Some safety net programs disappearing over the decades. All of these factors tending to make it harder for people to be able to afford to be adequately housed. Situations that often aren't of their own making.
Okay, thank you. Thank you for that very thoroughgoing answer. We have a couple of other questions, one from legislator Mike Sigler. And Mike is asking, once a right is recognized, it's justifiably very difficult to curtail that right. Does the panel see any reason to lose this proposed right? Danger to other tenants or themselves, for example?
I can talk a little bit about this. I think there's a misconception that folks living in permanent supportive housing have no rules and no consequences. Please remember, they all have leases, which means they are subject to being held accountable for objectionable tenancy. Program staff work to support folks through crisis situations, but they don't inhibit natural consequences to behavior. We don't encourage poor behavior and allow people to do whatever they want. Consequences can take time, sometimes through the legal system, sometimes, the staff on site in our programs, that I can only speak to Tompkins Community Action, the staff tries to address the root causes of whatever the behaviors are by linking to services that are available in the community, mental health treatment, substance abuse treatment, those kind of core things. There are access and barriers, and the staff are available to help facilitate those connections. It's not a perfect system. There are a lot of barriers. Staff show up every day to start the process again and again and again. It's really where the relationship building with our residents comes in and makes things move forward. But again, you can still be evicted in a permanent supportive housing program. That's not our goal, but at times that is an appropriate measure.
Okay, thank you, Danielle. Are there others who wish to respond to Mike?
I would just add to that when someone threatens violence or is a threat to others, in much the same way that their freedom could be taken temporarily, in this case too, there will be consequences, because the goal is for safety and security that the housing will provide.
Mhm. Mhm. Okay, thank you, Rick.
I have one little thing to add.
Yes, yes.
Because it speaks to the rights part of that question, right? So what I would assert is that the fact that housing is not a human right is actually contributing to the scarcity of the housing that is accessible to people who need it, and the concentrations that we see in that housing of behaviors that people wish to not see in housing. So those are all people who don't have a right to their own, don't have a right to housing at all. Making it a right and increasing that access to people would actually reduce, in theory, right? If we could have a place for every person who has a need for housing with supports because they have a right to it, I think that would at least mitigate some of the concentrations of like unsafe behaviors that you see in housing now. So I think it would be short-sighted to say you can't have a right to housing because of behaviors, and it actually would work better if you flip that the other way. Housing isn't the place. Housing is not part of like law and order, right? So if people want to see um, people have a right to do their time in jail and get out of jail and restart in the community, right? That the housing shouldn't be enforcing a right that that people believe that they're guaranteed through that law and order system, right? Like you're supposed to be able to start again. But what housing is being asked to do is actually screen out people who have those negative criminal histories in such a way that they cannot access the housing. And then that behavior is scattered sort of across the community instead of just in their own housing, which they could have a right to.
Thank you,
Sorry.
ladies. No, no problem. No problem. Any other panelists wish to respond? Okay, we have a question from Ithaca Crime, which is a local crime blog. Do you sacrifice safe housing for some people by putting others who are not ready to live independently into apartments where they are bad neighbors, which is a little bit of a variation on Mike's question.
I think I want to answer this carefully. I want to say that it's easy to blame problems in a building on a certain population without seeing the bigger picture of the entire building. Tompkins Community Action served 40 units at a newer building that's had a lot of problems. And there are an additional 141 units in that building as well. It's a large building. It's also under the microscope. Again, I'd like to just remind that permanent supportive housing doesn't excuse bad behavior. People are held accountable. Also, the systems in place, they take some time. There's not an instant, the eviction process is a process. It's easy to see something in the news and then wonder why nothing's happening. And people have a right to privacy. So I think I'll leave it at that.
Responses from others?
I just want to point out, Dr. Klepack highlighted these issues have been going on, for decades, 70s and 80s, and that these are evolving processes. These are self-correcting processes. We are always attempting to be better at delivering these services, so that the goal again is to continue to get better at these and to provide the safe and stable housing that people deserve.
Dan, were you going to respond?
Yeah, just briefly, and I want to be careful too about answering this because obviously, I think probably part of a theoretical human right to housing is, safe safe housing. It's not much of a right if it's not safe housing. Um, and with most rights, I think there could be reasonable restrictions to it, but I I don't think bad behavior means you don't necessarily have a right to any housing. It might trigger restrictions on where you could be housed and under a theoretical regime of a universal right to housing. But I think, and I'm sure we could come up with some extreme exceptions to this, but I think, you know, bad behavior could mean there are certain restrictions on your right to housing, but I don't think, uh, at least for the most part, we would advocate, if a bad actor, if you're a bad actor, that means you should be homeless. I think, a lot of the time, if you've acted badly, there's some underlying issue that needs to be addressed, and even if the person is having issues, that doesn't necessarily mean that they should be out on the streets. There should be a support system in place that can address their poor behavior, so that they can you know, be rehabilitated or whatever the mention or whatever the issue might be.
Okay. Thank you, Dan and Rick.
Yeah.
One other question, again from Ethical Crime. Also curious if the gentleman from Law New York, Dan, could speak to his organization's lawsuit against the Vecino Group concerning the art house. How is this progressing?
Yeah, obviously there are client confidentiality issues involved there, so I can't get into too many of the details. I'm also not personally working on that matter, but I think my understanding is the parties have reached a resolution of that case, where I believe the Vecino Group is going to be taking some measure of corrective actions over there. But I don't think I'm not really at liberty to say anything further than that at this time.
Okay. Are there any final comments that any of you would like to make in relation to what we have discussed that you've not been able or did not make in your presentations?
I would just like to say that with regard to substance use, something that we're all concerned about and something which affects the safety of our environment for our children and for the general public and so on, that again, the longer that people are inadequately housed or homeless and all that stress that they endure, it's very tempting to fall into substance use as a way to blunt the fear and the insecurity. And if you weren't already involved with substances when you became inadequately housed, you might find yourself kind of using it as an escape hatch. So again, underscoring a community need to do whatever we can to make sure that people are one time inadequately housed as brief as possible and try to get them into a stable situation.
Okay.
Yeah. I'd just like to add about that last question. I know this is probably a very unsatisfying answer for most of us here on the call, but I should just say too, my understanding is Vecino has not admitted to any liability in that lawsuit at all. I know that's a very lawyer answer, but I just got to make sure that that's clear as well in response to that product question.
Thanks, Dan.
Yeah.
And our final question from the chat. Are we anticipating an increase in affordable housing in 2025 to relieve some of the current bottleneck that currently exists, getting people from emergency housing to long-term from the Women's Opportunity Center?
But certainly the Cherry Street project is one that should be of some help. And in my conversations with our public health director, I know he's extremely concerned that that project be also enabled with aggressive and fairly comprehensive supportive services to provide to those people being coming into that facility in order to help with, as we were just talking, the safety of one neighbor with another, and the ability of people to transition into a housed situation from maybe a fairly long period of being inadequately housed.
Other comments? Going once, twice. Okay, well, I want to thank each and every one of our panelists for really giving a very thoroughgoing, comprehensive response to housing and human rights. Thank you all for your time and for sharing your wisdom, your expertise, and your practical suggestions. And to thank the audience who has come to join us this afternoon for this program. So again, thanks to all of you involved, and thank you all those who submitted questions as well. And again, thank you for being here and for contributing to today's ACT program. Thanks very much. Happy holidays to all, and we will see you in the new year. Okay, I think we might be off now. So, okay, well, thank you all so much again for.